Today I'll be discussing about the treatment of PCOD. So the treatment of PCOD is divided into three things. I'll be talking about something first which is most important, and the rest of the things are basically directed towards what symptom you have. So the most important thing in PCOD is to eat healthy, to maintain a healthy lifestyle. So the main thing is you have to maintain an ideal body weight, that is your BMI, that is weight in kgs divided by height in centimeters square, should be less than 23.5. That is the main thing. You can achieve it by restricting the calories that you are taking, have more healthy foods like salads, fresh vegetables, reduce on your carbohydrate like rice and chapati or idli dosa, go for healthier options like oats, pesarattu, reduce your oil content, eat less oil, butter and ghee, and along with diet, make it a habit that you exercise daily for at least half an hour. That is extremely important. So this we say for all our PCOD patients, even if they are overweight, even if they are normal weight, whatever it is, exercise is the most important thing and try to maintain an ideal body weight. Once you do this, a lot of your symptoms might just themselves disappear. A lot of ladies who are trying to conceive since years together, when they lose weight, conception happens. Again, a lot of people start having regular periods. A lot of people with PCOD may have pimples. They start disappearing once you lose weight. So it is extremely important to maintain ideal weight, eat healthy and exercise regularly. Other than that, if you have period problems, if your periods are very irregular, then we prescribe you medicines, we prescribe you hormone tablets. So basically in PCOD there is an imbalance of your hormones. Some hormones are more, some hormones are less. So when we give you that hormone tablet, it maintains, it regularizes, it causes regulation of those hormones. So that is what we do. We give you 21 days hormonal tablets and we tell you to take it regularly so that the periods come regularly. That is one thing. Again, this plus lifestyle, that is diet and exercise, I keep on emphasizing because that is the most important thing for all PCOD patients. That ultimately leads to regular periods. If someone has, the main problem is if increased hair growth, then again we give hormone pills. There are certain hormone pills which are preferred for this problem. Other than hormone pills, there are some other tablets that we give if you have more hair growth over your face. A lot of people ask whether laser, if they can go for laser. So yes, definitely you can go, you should go for laser. But the thing is that only laser is not going to help, because again a lot of people come who have taken laser but again they say the hair is regrowing. That is going to happen because the main problem is a hormonal imbalance. So till we don't regulate it, till we don't regulate your hormonal imbalance, just doing laser is not going to help. But doing both the things together, going for laser as well as treating the hormonal imbalance, gives the best results. So tablets to maintain, to regulate your hormones plus laser, both combined together give you best results for your hair growth. So that is for hair growth. Again, if someone wants to conceive, a lot of patients with PCOD who want to conceive naturally. So it is not that if you have PCOD, it is 100% that you might need some artificial technique. Most of the patients with PCOD conceive. In fact, a lot of times what happens is after conception, after they have completed their family, they come and we come to know that they had PCOD since a long time. So it does not mean that if you have PCOD, there is going to be fertility issue completely. For some people, there can be difficulty in conception because a lot of eggs develop simultaneously and one egg doesn't become big and mature. So for such people who are not having what we call ovulatory cycles, in whom one egg doesn't come out every month, for such people there is treatment for that as well. There are drugs which can cause ovulation induction. There are drugs which cause that one follicle to mature and rupture. So for fertility also, try naturally. If after 1 year of trying, if you are below 35 years of age, if you have been trying for 1 year since and still you are not able to conceive, then we can go for artificial treatments for conception. So these are the main treatments. The main thing is going to be lifestyle changes, as I just told. Second thing, depending on your symptoms, if you have irregular periods, we give you treatment. If your main concern is hair growth over the face, we give you treatment. If your main concern is infertility, we give you another type of treatment. Again, for all PCOD patients, we need to keep a check on the diabetes, whether you are developing diabetes or if you have pre-diabetes, if you are at risk of developing diabetes. So these things need to be taken care of. In those patients who have diabetes or are trying to conceive, and if their insulin levels in body is high, then we give metformin. Again, it leads to it, of course, as I had told in my other videos, that insulin resistance is what causes PCOD. So metformin is something that acts on that. It causes sensitization of insulin. So the resistance component goes down, sugars improve, there is increased chance of conception as well. So for such people, we give metformin. And so these are mainly the treatment of PCOD.